Welcome back to Medical Terminology. We're entering week 5, which means we're halfway through our term, and we're going to be discussing pulmonology and gastroenterology, which are chapters 10 and 11. For chapter 10, you're going to want to be able to describe the medical specialty of pulmonology, understand the functions of the respiratory system, define pulmonology-related combining forms, prefixes, and suffixes, identify the organs treated in pulmonology, build pulmonology medical terms from word parts, explain pulmonology medical terms, and use pulmonology abbreviations. Pulmonology is the diagnosis and treatment of diseases of the lower respiratory system and the chest cavity. Pulmonologists treat cancer, infections, diseases, and injuries of the lungs and the pleura, which are the sacs that surround the lungs. Thoracic surgeons surgically treat conditions of the lungs and the thoracic cavity, and respiratory therapists work with doctors to provide therapeutic respiratory care. All of the body's cells need to have a constant supply of oxygen to produce energy. The respiratory system is what's going to bring fresh oxygen into the lungs through inhalation or inspiration. From the lungs, the oxygen passes into the bloodstream, and then the blood delivers the oxygen to the cells, and it picks up carbon dioxide as waste, which then passes into the lungs, and it's removed from the body through a process called exhalation or expiration. So let's look at the organs that are treated in pulmonology. Let's start with the trachea. It's the tube that carries the air from the throat into the chest. It's also called the windpipe. After entering the thoracic cavity, the trachea divides into the two primary bronchi. The right primary bronchus serves the right lung, and the left primary bronchus serves the left lung. In the lungs, the bronchi subdivide into secondary and tertiary bronchi, and then they become very narrow bronchioles. Alveoli are found at the end of the bronchioles, and an alveolus is a thin-walled air sac where oxygen exchange occurs. You have capillaries that surround the alveoli so that gases, carbon dioxide and oxygen, can cross the thin alveoli and capillary walls. Bronchioles and alveoli are housed in the lungs, and the lungs are paired organs that are in the thoracic cavity. Their primary function is to carry air to and from the alveoli. The lungs are divided into lobes. The right lung has 3 lobes, the superior, middle, and inferior, while the left lung has 2 lobes, just the superior and inferior. The pleura is a double-layer membrane that forms a protective sac around the lungs. It has 2 layers. The parietal pleura lines the thoracic cavity, while the visceral pleura covers the lungs. The folds in the pleura create a space between the 2 layers known as the pleura cavity. Let's review some pulmonology combining forms. Aero, air. Alveolo refers to alveolus or air sac. Broncho and bronchio both refer to bronchus. Bronchiolo refers to bronchiole. Cono, dust. Cyano, blue. Diaphragmato, diaphragm. Halo, to breathe. Lobo, lobe. Mediastino refers to mediastinum. Oxy, oxygen. Pleural, pleura. Pneumo, lung or air. Pneumono, lung. Pulmono, lung. Spiro, breathing. Thoraco, chest. Tracheo, trachea. Tusso, cough. Here are a few more combining forms that aren't specific to pulmonology or the respiratory system, but they will help you when forming words for this chapter. Angio, vessel. Arterio, artery. Atello, incomplete. Carcino, cancer. Cardio, heart. Cyto, cell. Embolo, plug. Fibro, fibrous. Hemo, blood. Ortho, straight. And pio refers to pus. Let's quickly review suffixes again. Al, pertaining to. Algia, pain. R, Aryan, attic, all mean pertaining to. Synthesis is a puncture to withdraw fluid. Dynia, pain. Ectasis, dilated. Ectomy, surgical removal. Genic, producing. Gram, a record. Graph, an instrument for recording. Graphy, a process of recording. Ia, condition. Ic, pertaining to. Itis, inflammation. And logist is one who studies. Logi, the study of. Meter, instrument for measuring. Metry, process of measuring. Ol is small. Oma is a tumor or a mass. Osis is an abnormal condition. Ostomy is to surgically create an opening. Otomy is cutting into. Oxia, oxygen. Plasty, surgical repair. Pnea, breathing. ptysis, spitting; scope, instrument for viewing; scopy, process of visually examining; spasm is an involuntary muscle contraction; and thorax refers to chest. And here are a few prefixes we'll be using in this chapter. A without, and without, anti, against; Brady, slow; dis, difficult, painful, or abnormal; endo, within, inner; u, normal or good; x, outward; hyper, excessive; hypo, below or insufficient; in is inward; tachy, fast. Now that we reviewed pulmonology word parts, you should pause here and do the work on page 180 if you're using the 3rd edition to build pulmonology terms. Then come back and we can work through it together. Okay, let's begin. Alveola is a combining form that means alveolus. Alveolar means pertaining to the alveolus. Alveolar gas exchange is occurring in this figure. A bronchoscope is an instrument for viewing the bronchus. A bronchospasm is an involuntary muscle contraction of the bronchus. Bronchiole means small bronchus. So basically what you have is the primary, secondary, and tertiary bronchi that branched into smaller and smaller bronchioles. A bronchiectasis means a dilated bronchus. Bronchiolar means pertaining to a bronchiole. Pneumoconiosis is an abnormal condition of dust in the lungs. Cyano is a combining form that means blue. Cyanosis means an abnormal condition of being blue. Blood that's low in oxygen is a deep dark red color that can give skin a blue tint. Diaphragmatic means pertaining to the diaphragm. The diaphragm contracts, and what it does is it moves down during the inhalation process, and this causes an expansion in the volume in the thoracic cavity, which causes expansion of the lungs. The opposite happens with exhalation. The diaphragm actually relaxes, and this allows air to be moved out of the lungs through the trachea and out the mouth. This process is called exhalation. Lobectomy is the surgical removal of a lobe, and recall that there are multiple lobes in the lungs. Mediastino is a combining form meaning mediastinum, which is the central region of the thoracic cavity between the lungs, and that's where the trachea, heart, aorta, esophagus, lymph nodes, and thymus gland are located. Mediastinal is pertaining to the mediastinum. Mediastinotomy is cutting into the mediastinum. Orthopnea is breathing sitting up straight. Oxy is a combining form meaning oxygen. An instrument for measuring oxygen is an oximeter. The process of measuring oxygen is oximetry. Pleurocentesis is to puncture the pleura to withdraw fluid. Pleuralgia is pleural pain. Dyspnea is difficulty breathing. Hypopnea is insufficient or shallow breathing, and tachypnea is fast breathing. Pneumograph is an instrument for recording the lungs, and pneumothorax is air in the chest. Pneumonocentesis is a lung puncture to withdraw fluid. Pneumonotomy is cutting into the lung. Pulmonologist is one who studies lungs. Spitting up blood is hemoptysis. The process of measuring breathing is spirometry. Thoracalgia is chest pain. Thoracotomy is cutting into the chest, and thoracostomy is surgically create an opening in the chest. A hemothorax is blood in the chest. Tracheotomy is to cut into the chest, and endotracheal refers to pertaining to within the trachea. Okay, let's go through some pulmonology vocabulary. So, acute respiratory distress syndrome, or ARDS, is an acute respiratory failure in adults It's characterized by tachypnea, dyspnea, cyanosis, tachycardia, and hypoxia, also called adult respiratory distress syndrome. Aerosol therapy is a medication suspended in a mist so that it can be inhaled. It's often delivered by a nebulizer or a metered-dose inhaler. Antitussive is a medication used to relieve the urge to cough. Arterial blood gases, abbreviated ABG, is a laboratory test for levels of oxygen and carbon dioxide in the blood. Asphyxia, or to asphyxiate, or asphyxiation, is the lack of oxygen that can lead to unconsciousness and death if not corrected immediately. Some common causes are drowning, foreign body in the respiratory tract, poisoning, electric shock, also called suffocation. To aspirate is to inhale a fluid or a foreign object into the airways. Asthma is a disease caused by various conditions such as allergies, and it results in bronchospasms, seen here in the figure, excessive mucus production, inflammation, airway constriction, wheezing, and coughing. Atelectasis is a condition in which lung tissues collapse, preventing respiratory exchange of oxygen and carbon dioxide. A bronchodilator is a medication that causes the bronchi to dilate, which can be used to treat asthma. A bronchogenic carcinoma is a malignant lung tumor that originates in bronchi and is often associated with a history of cigarette smoking. Cardiopulmonary resuscitation, abbreviated CPR, is a combination of external compressions on the sternum and rescue breathing that helps maintain blood flow and air movement in and out of the lungs during cardiac and respiratory arrest. A chest x-ray is used to take a radiographic image of the heart and the lungs, and it may be an anterior, posterior, or lateral view. Chronic obstructive pulmonary disease, abbreviated COPD, is a progressive, chronic, and usually irreversible condition in which airflow to and from the lungs is decreased. The patient may have severe dyspnea with exertion and cough, and it's also called chronic obstructive lung disease, or COLD. Continuous positive airway pressure, or CPAP, is a machine that supplies constant steady air pressure through a mask, and this keeps the airways continuously open. It's often a common treatment for sleep apnea. Crackles is an abnormal rattling or crackling sound made during inhalation, and this is caused by mucus or fluid in the airways, also called rales. Croup is an acute viral infection in infants and children. The symptoms include dyspnea and a barking cough. Cystic fibrosis is a genetic condition that causes patients to produce very thick mucus, resulting in severe congestion in the lungs and the digestive system. Emphysema is a pulmonary condition with destruction of alveolar walls that leads to overinflated alveoli, and this can occur because of long-term heavy smoking or exposure to air pollution, characterized by dyspnea on exertion. And an endotracheal intubation, or ET tube, is placing a tube through the mouth and into the trachea to maintain an open airway. An expectorant is a medication that improves the ability to cough up mucus from the respiratory tract. The Heimlich maneuver is a technique for removing a foreign body from the trachea or pharynx by exerting a sharp pressure on the diaphragm. Hyperventilation is to breathe too quickly and too deeply, while hypoventilation is to breathe too slowly and too shallowly. Hypoxia means to have insufficient amounts of oxygen in the body. Infant respiratory distress syndrome, IRDS, is a common condition seen in premature infants whose lungs have not fully developed. The lungs aren't able to expand, and this causes extreme difficulty in breathing. This is also known as hyaline membrane disease, HMD. Influenza, or the flu, is an acute viral infection of the airways. It's usually highly contagious, and the symptoms include chills, fever, body aches, and a dry cough. Intermittent positive pressure breathing is a method of artificial ventilation using a mask that's connected to a machine that produces pressure to assist air to fill lungs. A metered dose inhaler is a mechanism that delivers aerosol therapy in single puffs of mist or powder. A nebulizer is a mechanism that delivers aerosol therapy mist, usually via a mask, over time as a person breathes. And phlegm is a thick mucus secreted by the mucous membranes lining the respiratory tract. Phlegm that is coughed out is called sputum. A pleural effusion is the abnormal presence of fluid or gas in the pleural cavity, and it can be detected by tapping the chest or listening with a stethoscope. Pleural friction rub is a crunching sound made when inflamed pleura rub against each other, like the sound of walking on fresh snow. Pleurisy is the inflammation of pleura. Pneumonia is an acute inflammatory condition of the lungs that can be caused by bacteria or viral infections, diseases, and chemicals. Severe dyspnea and death can result when the alveoli fill with fluid called pulmonary infiltrate. A pneumothorax is a collection of air or gas in the pleural cavity, and this can result in a collapsed lung. Postural drainage is the drainage of secretions from the bronchi by placing a patient in a position that uses gravity to promote drainage. It's used for treatment of cystic fibrosis and bronchiectasis. Pulmonary angiography is injecting a dye into a blood vessel for the purpose of taking x-rays of arteries and veins of the lungs. This is a diagnostic test used to diagnose pulmonary embolism. Pulmonary edema is a condition in which lung tissue retains an excessive amount of fluid, and this also results in dyspnea. Pulmonary embolism, or PE, is a blood clot or air bubble in the pulmonary artery or one of its branches, and this results in an infarct of lung tissue. Pulmonary function test, PFT, is a diagnostic procedure to assess respiratory function by using a spirometer to measure airflow and lung volumes. It's often performed by respiratory therapists. Purulent means containing pus, as in purulent sputum. Respiratory rate, abbreviated RR, is the number of breaths per minute. It's one of the vital signs that doctors often take, including heart rate, temperature, and blood pressure. Severe acute respiratory syndrome, abbreviated SARS, was a severe and highly contagious viral lung infection with high fever that threatened a worldwide epidemic in 2003. The term sputum means mucus or phlegm that's coughed up and spit out from the respiratory tract. Sputum culture and sensitivity, or CNS, is a testing sputum by placing it in a culture medium and observing any bacterial growth. The specimen is tested to determine the selection of effective antibiotics. Sputum cytology is to examine sputum for malignant cells, and sudden infant death syndrome, SIDS, is unexplained death of an apparently well infant. Sleep apnea, airway spasms, and failure of nerves to stimulate the diaphragm have been studied as possible causes of SIDS. A sweat test is a diagnostic test for cystic fibrosis. Children with this disease lose an excessive amount of salt in their sweat. Tuberculosis, abbreviated TB, is an infectious disease caused by the bacteria Mycobacterium tuberculosis. Most commonly affects the respiratory tract and causes inflammation and calcification of the lungs. A tuberculin skin test, abbreviated TB test, is a diagnostic procedure to expose tuberculosis bacteria by injecting purified protein derivative, PPD, under the surface of the skin and evaluating the site for a reaction. It's also called a Manteau test. A ventilation perfusion scan is a nuclear medicine image particularly useful in diagnosing a pulmonary embolism. It involves inhaling radioactive tagged air to evaluate air movement and injecting a radioactive tagged dye into the bloodstream to evaluate blood flow to the lungs. A ventilator is a mechanical device to assist a patient to breathe. It's also called a respirator. To wheeze is a whistling sound that can be heard during either inhalation or exhalation, and this is caused by the narrowing of bronchi, as in an asthma or infection. It's also called rhonchi. Okay, let's review some pulmonary abbreviations. ABGs, arterial blood gas. ARF, acute respiratory failure. ARD, acute respiratory disease. ARDS, acute respiratory disease syndrome. Broncho refers to bronchoscopy. BS is breath sounds. CF, cystic fibrosis. CO2, carbon dioxide. COLD, chronic obstructive lung disease. COPD, chronic obstructive pulmonary disease. CPAP, continuous positive airway pressure, and CPR, cardiopulmonary resuscitation. The CNS is a sputum culture and sensitivity test, CTA, clear to auscultation. So it's clear chest sounds. CXR is a chest x-ray. DOE, dyspnea upon exertion. ET refers to endotracheal. Flu, influenza. HMD, hyaline membrane disease. IPPB, intermittent positive pressure breathing. IRDS, infant respiratory distress syndrome. LLL would be referring to the left lower lobe of the lung. LUL, left upper lobe. MDI, metered dose inhaler. O2 refers to oxygen. PE, pulmonary embolism. PFT, pulmonary function test. PPD, it's a purified protein derivative that's used to test for exposure to TB. R is respirations. RD, respiratory disease. RDS, respiratory distress syndrome. RLL, right lower lobe. RML, right middle lobe. And RR, respiratory rate. RRT is a registered respiratory therapist. RT is a respiratory therapist or respiratory therapy, and RUL is right upper lobe of the lung. SARS, severe acute respiratory syndrome. SIDS, sudden infant death syndrome. SOB, shortness of breath. TB, tuberculosis. TPR, temperature, pulse, and respiration, which are all vital signs. Well, that's the end of chapter 10. Now remember to complete the practice and review at the end of chapter 10, starting on page 196 if you're using the third edition, before you go on and do the homework or the quiz for this week. On to chapter 11. For this chapter, we will want to be able to describe the medical specialty of gastroenterology, understand the functions of the digestive system, define gastroenterology-related combining forms, prefixes, and suffixes, identify the organs treated in gastroenterology, build gastroenterology medical terms from word parts, explain gastroenterology medical terms, and use gastroenterology abbreviations. Gastroenterology specializes in the diagnosis and treatment of lower gastrointestinal diseases and conditions. Gastroenterologists treat bleeding, cancer, and infections of the gastrointestinal tract or GI tract. They also handle nutritional and inflammatory disorders, diverticulosis, GERD, and ulcers. Gallbladder and liver diseases fall under the care of gastroenterologists as well. The digestive system is responsible for digesting foods and absorbing the nutrients in the food. Digestive processes occur as food passes through the GI tract, and it goes from the mouth to the pharynx, esophagus, stomach, small intestine, large intestine. The liver, the gallbladder, and the pancreas are accessory organs that assist the GI organs. So let's learn about some of these GI organs. The esophagus is a muscular tube that carries food from the throat to the stomach. The stomach is then a muscular sac that produces hydrochloric acid and enzymes that chemically break down food. Food mixes with acid and the enzymes to produce something called chyme, and then chyme leaves the stomach and enters the small intestine. The small intestine breaks down foods into nutrient molecules which it absorbs, and there are three sections in the small intestine. The duodenum receives the chyme, digestive enzymes, and bile, and begins final digestion of food and absorption of nutrients. The jejunum continues digestion and absorption, and the ileum completes digestion and absorption and passes the remaining material to the large intestine. The large intestine then reabsorbs fluid, so most of your water is reabsorbed here, and compacts waste into feces. There are four sections in the large intestine. The cecum connects the small and large intestine. The colon reabsorbs water and forms feces. The rectum stores feces prior to elimination, and then the anus opens to the outside during elimination. You also have accessory organs that are important to digestion. The liver produces bile that helps to digest fat. The gallbladder stores the bile and then releases it into the duodenum via the common bile duct. And the pancreas produces enzymes and buffers and releases them into the duodenum via the pancreatic duct. Here are some gastroenterology combining forms that you'll need to know. Ano refers to anus, appendo and appendico refer to the appendix, cola refers to bile, cholangio, bile duct, cholecysto, gallbladder, choledochos, common bile duct, cholo and colano is colon, diverticulo refers to diverticulum, duodeno, duodenum, enterointestine, esophago is esophagus, gastro, stomach, hepatoliver, ileo, ileum, jejuno, jejunum, and lepero, abdomen. Pancreato, pancreas, polypo, polyp, procto, rectus and anus, recto, rectum, sigmoido, sigmoid colon. And here are a few other combining forms that aren't specific to gastroenterology, but they will help you with this chapter. Baro, weight, hemato, blood, inguino, groin, litho, stone, naso, nose. Okay, let's review some suffixes again. Al, pertaining to algia, pain. Seal, protrusion, dynia, pain. Eel, pertaining to ectomy, surgical removal. Emesis, vomiting. Emetic, pertaining to vomiting. Gram is a record. Graphy is a process of recording. Iasis is an abnormal condition. Iatric is a medical specialty. Ick, pertaining to itis, inflammation. Logist is one who studies, and logi is the study of. Oma, a tumor. Osis, an abnormal condition. Ostomy, surgically create an opening. Otomy, cutting into. Pepsia, digestion. Phasia, eating or swallowing. Plasty is surgical repair. Ptosis is drooping. Scope, instrument for viewing. Scopy, process of visual examining. And trypsy, surgical crushing. Here are some prefixes you would need to know too. A, without, anti, against, Brady, slow, dis, painful, difficult, or abnormal. Hyper is excessive, and poly is many. Okay, we're going to build some gastroenterology terms. So open your book and we'll work through some of them. You're going to start on page 209 and pause it here, go do the work, and then come back and we'll see how you did. All right, let's look at the terms together. Ano is a combining form that means anus, pertaining to the anus, anal. Surgical removal of the appendix, appendectomy. Appendix inflammation, appendicitis. A condition of having bile stones or gallstones is cholelithiasis. Surgical crushing of bile stones or gallstones is cholelithotripsy. The process of recording a bile duct is cholangiography. Cholecysto is a combining form that means gallbladder. Gallbladder inflammation is cholecystitis. Surgical removal of the gallbladder is cholecystectomy. Choledocholithiasis is a condition of a stone in the common bile duct. Colostomy is to surgically create an opening in the colon. Colorectal is pertaining to the colon and the rectum. A colonoscope is an instrument for viewing the colon. Diverticulitis is a term that means diverticulum inflammation. Duodenal means pertaining to the duodenum, and duodenostomy is to surgically create an opening in the duodenum. Emesis is a suffix that means vomiting. Hyperemesis is excessive vomiting. Enteric means pertaining to the intestine. Esophageal means pertaining to the esophagus, Esophagoplasty means surgical repair of the esophagus. Gastroenteritis is the inflammation of the stomach and the intestine. Gastrectomy would be surgical removal of the stomach, and gastrostomy is to surgically create an opening in the stomach. Recall that hepato means liver, so a hepatoma would be a liver tumor. An ileostomy is to surgically create an opening in the ileum. Jejunal means pertaining to the jejunum. Laparoscopy is the process of visually examining the abdomen. Pancreatic means pertaining to the pancreas. Bradypepsia is slow digestion. Since phasia is a suffix that means eating or swallowing, aphasia means without swallowing. Polyposis is an abnormal condition of having polyps. Proctoptosis is the drooping of the rectum and the anus. Proctology is the study of the rectum and the anus. Rectocele is the protrusion of the rectum. Sigmoidoscopy is the process of visualizing the sigmoid colon. So that's it for building gastroenterology terms. How did you do? Let's review some gastroenterology vocabulary. An antacid is a medication used to neutralize stomach acids. Antidiarrheal are medications used to control diarrhea. Antiemetic is a medication to treat nausea, vomiting, and motion sickness. Ascites is the accumulation of fluid in the abdominal cavity. Bariatric surgery is a group of surgical procedures designed to treat extreme obesity by reducing the size of the stomach or diverting food from passing through a portion of the gastrointestinal tract. A barium enema, abbreviated BE, is an X-ray examination of the large intestine using barium as a contrast medium. It's also known as a lower GI series. Cirrhosis is a chronic liver disease. Colorectal cancer is a cancerous tumor originating in the lining of the colon or the rectum. Constipation is difficulty passing a bowel movement, abbreviated BM, or infrequent bowel movements. Crohn's disease, also called chronic inflammatory bowel disease with mucous membrane ulcers, and is most often found in the ileum. Diarrhea is passing frequent watery or bloody bowel movements. Dysentery is an acute intestinal condition with pain, diarrhea, and blood and mucus in the stool. It's usually caused by a bacterial or parasitic infection. Esophageal atresia is a congenital lack of the connection between the esophagus and stomach, where food cannot enter the stomach. Esophageal varices are varicose veins in the esophagus, and they result in massive bleeding if they rupture. Fecal occult blood test, or FOBT, is a clinical test for presence of small amounts of blood in the feces. It's also called a Hematology test or a stool guaiac test. Gastric banding is one type of bariatric surgery. A restrictive band, also called a lap band, is placed around the stomach, and it prevents the stomach from expanding to hold a large amount of food, which leads to a smaller meal. Gastric bypass, also another type of bariatric surgery, is where a major portion of the stomach is surgically disconnected from the GI tract, but not removed from the body. This leaves the esophagus emptying into a small gastric pouch, which then empties into the duodenum. Gastric stapling is another type of bariatric surgery which closes off a large section of the stomach with rows of staples, and this results in a smaller stomach that cannot hold large meals. Gastroesophageal reflux disease, or GERD, occurs when the stomach acid backs up into the esophagus. Helicobacter pylori antibody test, or an H. pylori antibody test, is a clinical lab test for the presence of bacteria known to cause gastric ulcers. Hematochezia is the presence of bright red blood in a bowel movement. Hemorrhoids are varicose veins in the rectum. A hiatal hernia is a protrusion of a portion of the stomach through the diaphragm and into the thoracic cavity. Gastroesophageal reflux disease is a common symptom of this type of hernia. An ileus is an obstruction of the intestine that occurs when muscular movements stop moving food or blockage prevents food from moving through the digestive tract. An inguinal hernia is a protrusion of a small loop of intestine through a weak spot in the abdominal muscle wall and into the groin region. It may become incarcerated or trapped and strangulated if muscle tightens around the loop and cuts off its blood supply. Intussusception occurs when one section of the intestine slips or telescopes into another section of the intestine. Irritable bowel syndrome, abbreviated IBS, is a disturbance in normal functioning of bowel characterized by abdominal pain and diarrhea. It's often associated with stress and it's also called spastic colon. Jaundice is a yellow-colored skin and whites of the eyes associated with liver disease. A laxative is a medication to treat constipation. Melena is very dark, tarry stools due to the presence of blood. Nasogastric or NG intubation is a procedure in which a flexible tube is placed down through the nose, down the esophagus, and into the stomach, and it may be used for gavage, which is placing liquid nourishment directly into the stomach, lavage, which is washing out the stomach to remove a dangerous substance, or to suction out stomach fluids. Nausea is the feeling of the urge to vomit. Ova and parasites, or O&P, is a clinical lab test for the presence of parasites or their eggs in feces. Peptic ulcer disease is crater-like erosion in the mucous membrane of the lower esophagus, stomach, or the duodenum. More dangerous if the ulcer eats into blood vessels and becomes a bleeding disorder, or if the ulcer eats through the wall of the stomach and becomes a perforated ulcer, allowing stomach acids into the abdominal cavity. A proton pump inhibitor is a medication used to treat peptic ulcer disease and gastroesophageal reflux disease by blocking the stomach's ability to secrete acid. Total parenteral nutrition, or TPN, is a nutrition complete solution given directly into the bloodstream when a person cannot eat by mouth. Ulcerative colitis is a chronic inflammatory bowel disease, IBD, characterized by the formation of ulcers on the mucous membrane of the colon. An upper gastrointestinal series is the X-ray examination of the esophagus and stomach using barium as a contrast method. It's also known as a barium swallow. A volvulus occurs when a length of bowel becomes twisted around itself. Vomit is the forceful return of stomach contents out of the mouth, also known as emesis. Okay, let's do some gastroenterology abbreviations. Some of these we're going to have to pause on because there's some pretty long words. BA stands for barium, BE, barium enema, BM, bowel movements, BS, bowel sounds, CBD, common bile duct, CUC, chronic ulcerative colitis, EGD, this is a long one, esophagogastroduodenoscopy, ERCP, another long one, endoscopic retrograde cholangiopancreatography, FOBT, fecal occult blood test, GB, gallbladder, GERD, gastroesophageal reflux disease, GI stands for gastrointestinal, IBD, inflammatory bowel disease, IBS, inflammatory bowel syndrome. LES stands for the lower esophageal sphincter, N and V, nausea and vomiting, NG, nasogastric tube, O and P, ova and parasites, PUD, peptic ulcer disease, TPN, total parenteral nutrition, UGI, upper gastrointestinal series. All right, that's the end of Chapter 11. Complete the practice and review that begins on page 223 in the third edition of your book. and then you can do the rest of the work assigned for the week.